Hello dear student, welcome in Pharmaceutical Chemistry 2. Today we are going to deal with antibiotic. This is part 4. Myself Mrs. Urmila Ravindra Gaudi, M.Pharm in Quality Assurance and lecturer in KK Institute of Pharmacy, Sandori, Nasik. Learning outcomes. After listening, student will able to name cephalosporin according to IUPAC system, to recognize the different cephalosporins on the basis of structure, chemical name, physical property, and to recognize the different cephalosporin on the basis of their uses and official preparation with the brand names. Let's start with cephalosporins. Chemistry of cephalosporin. In this, beta-lactam ring is fused with 2,3-dihydro-6H-thiazolin ring, so that the nitrogen and adjacent carbon atom are common to both the ring. This gives a bicyclic heterocyclic ring system called 3-Cephame. This is the beta-lactam ring. This is 2,3-dihydro-6H-thiazine ring, and it is fused to beta-lactam ring to form a 3-Cephame, in which nitrogen and adjacent carbon atom are common to both the ring. The presence of double bond between carbon number 3 and 4 maintain the strain beta-lactam ring and increases resistance toward beta-lactamase enzyme. Allylic acetoxy group is present at C3 position. Carboxylic group is present at C4 position. Acyl amino group is present at C7 position. The example of cephalosporins are cephalexin, cephaloridin and cephalothin. Let's start with one by one. First drug is cephalexin. It is beta-lactam antibiotic. It differs from benzyl penicillin in having 3-methyl-4-carboxy 3-Cephame ring instead of 2,2-dimethyl-3-carboxylic penam ring and amino group at alpha carbon of benzyl radical. Physical property. It is white or cream colored crystalline powder. It has characteristic odor. It is sparingly soluble in water, very slightly soluble in alcohol and in chloroform. Its solution gives a pH 3.5 to 5.5. Chemical property. With a mixture of sulfuric acid and nitric acid, it gives yellow color. Stability and storage. It absorbs moisture and is affected by light, hence it is stored in tightly closed light-resistant container at a temperature not exceeding 30 degrees Celsius. Category: antibacterial. Uses: it is used to treat following infection due to susceptible organism: respiratory tract infection, skin and soft tissue infection, otitis, genitourinary tract infection, bone and joint infection, and dental infections. Pharmaceutical formulation. It is available in cephalexin capsule, cephalexin tablet, cephalexin mixture, and the brand names are Cefexin, Neocef and Cefaxin. Next drug is cephaloridin. It is beta-lactam antibiotic. It differs from penicillin in having C-Cephame ring instead of penam ring, 4-carboxylic and 3-pyridinium methyl group instead of 2,2-dimethyl and 3-carboxylic group, and thionyl methyl group instead of benzyl radical. Physical property. It occurs as white crystalline powder. It is odorless and has slight odor of pyridine. It has bitter taste. It is discolored in presence of light. It is freely soluble in water, very slightly soluble in chloroform. A 10% solution has pH 4 to 6. It is available in the alpha form and delta form. Chemical property. With a mixture of sulfuric acid and nitric acid, it gives permanent bluish green color. Stability and storage. It is discolored on exposed to light. Hence it is stored in sterile, tightly closed, light-resistant container which are sealed to exclude microorganisms and are kept in cool place. The label should bear whether the content are alpha form or delta form. Uses: It has a broader spectrum of antibacterial or antimicrobial activity. Therefore, it is used to treat urinary tract and respiratory tract infection, infection of skin and soft tissue, bone and joint infection. Pharmaceutical formulation. It is available in the form of cephalosporin injection, and the brand names are cephalosporin and cefadin. Next drug is cephalothin. It is differ from cephalosporin in having acetoxymethyl, that means ethanoyl loxymethyl group instead of pyridinium methyl group at C3 position. Physical property. It is official as sodium salt, which is white crystalline powder. It is odorless. It is freely soluble in water, practically insoluble in chloroform, and 10% aqueous solution has pH 4.5 to 5.5. Stability and storage condition. It is affected by light, hence it is stored in tightly closed light resistant container at a temperature not exceeding 25 degrees Celsius. If it is intended for parenteral administration, the container should be sterile and sealed to exclude microorganisms. If it is not intended for parenteral administration, then the label should be not to be injected. Uses. It has a broader spectrum of antimicrobial activity, hence it is used to treat urinary tract and respiratory tract infection, infections of skin and soft tissue, bone and joint infection. Dosage form cephalothin injection, and the brand name are Ceflin and Cefin. Thank you student for watching and attending the session.